Well, hello and a very warm welcome to the latest in our Choice Words videos, where we're going to do something a little bit different today. Instead of focusing on the wonderful worlds of fund selection, fund research, we are going to have a sector special and focus on the wonderful world of biotech. I'm Julian Marr, I'm editorial director of Wealthwise, and today I'm delighted to be talking to Linden Thomson, who's senior portfolio manager at Candrium, where she specializes in biotech and oncology strategies. Who better to talk about biotech? Hello, Linda.
Hi.
So let's jump into my first question. What most excites you about the outlook for biotech?
This is a sector that is at the forefront of biomedical research, innovation. It is the innovation heart of the healthcare sector. It's also a sector that has, good underlying growth drivers from the fact that we are all living longer. And as we age, we have more chronic diseases and use more healthcare. And also, we all have lifestyles that are now introducing more chronic illnesses. And so there is good underlying growth drivers. There's fantastic innovation. There has been that for 2 decades, and that continues. One particular therapeutic area that I'm interested in at the moment is neurology. We haven't seen much innovation there, and we all know the impact of, Alzheimer's, dementia more broadly, schizophrenia, etc. And so that is a area that I'm excited for, to see some of the innovation that comes through there. And then just more broadly on the outlook, I think what's the most exciting is the fact that we are now at, long-term lows in terms of valuations. We'll get into the reasons for that, I'm sure, in another question. And, as we progress through the rest of this year and into next year, I think there's really great opportunities for the sector here.
Well, it's a good start. It's an upbeat start. Sorry for bringing it down, but I think it does fit in what you've had to say, or what you were saying earlier, into valuations. What sector keeps you awake at night?
I mean, this is a sector that can be very volatile. You can have, big stock moves, and, that has to be incorporated within your portfolio and how you construct that portfolio. But it's certainly, not a sector for the faint-hearted. From a fund manager perspective, I kind of touched on this in the last answer to the question. We have the threat of the US getting involved in drug pricing and an impact to the FDA, which is the gatekeeper for the US, market for these companies, is something that we have feared for 5 to 10 years. We are now right in the middle of that, which has meant that the sector has sold off following a number of years of underperformance. This is the longest bear market we've seen in biotech. And that keeps me awake at night, but it also kind of excites me from here, because I do think that we are, we can look back around on this time in the next 2 or 3 years and probably see the bottom of the sector. And I do think that as we move forward, if we see a more efficient FDA come out of this, as we see drugs getting approved perhaps more quickly, that there is a lot of scope for upside from here.
So we turned that around. That's great. Let's zoom in there. That's the backdrop. But when you're looking at an individual investment as a specialist, and you're a huge scientific background, what do you most look for on the plus side, and what constitutes a red flag?
So the 2 main things I look at, I keep this fairly simple.
It's just for me.
No, just generally is, a great product that fills a medical need. If you have a drug in your pipeline that gets approved, that is highly efficacious for patients, that is better than something that's already on the market, or indeed even better, something that has never, been treated before with a brand new treatment that's safe and effective, the patients will use it and doctors will prescribe it, and you'll be able to get good pricing. And, that's the defensive nature of the healthcare pharma sector. So number one, you need to have a drug that you believe in, that you think will sell well, will have an impact on patients. The management of these companies is super important. You are essentially, as an investor, investing in their ability to take a drug from phase 1, early stage development, but through the clinical trials, through the regulatory, hurdles, and then onto the market. And that does require a huge skill set It's so both management quality and obviously an underlying great product that you can value the company on are two important points alongside valuation. I should probably put that at the end.
No, fair enough. Oh no, well then valuation, valuation. Red flags?
I always have a double take, ask a question where we lose management.
Mm-hmm.
Particularly for me, the chief scientific officer or the chief medical officer, when they choose to leave their position for another company or another job, it's not to say that they can't, but I always ask the question, why? Because, so much of their expertise, experience, future financial outlook, I would argue, is tied up in the ability for them to take that drug to commercial success, that I do often ask the question. It's not necessarily a red flag. They might have gone from this position to become a CEO, but it's definitely something that I would ask that question of.
Tricky. What are the most important qualities for being a successful biotech investor, in your opinion? What's the most overrated?
You need to have a scientific background. I think that not only helps, I think it's required, because, this job is still 70 or 80% science. The questions that you're asking for these, particularly these developmental stage companies, but also the large cap companies that are driven by pipelines, are scientific ones. How does this drug work? How does it compare to another drug? Are the clinical trials likely to be a success? They're not by and large financial questions. So that is a base that goes almost, without saying. I think, having done the job now for over a decade and having been in the biotech sector for 20 years, I think that there's, the longer I do this, the more I realize that experience matters, because there is the scientific fundamental side and there is the understanding of capital markets and understanding that this is a momentum-driven sector, that this is, somewhat cyclical in terms of sentiment, that, you can have good times and bad times, to be holding clients' hands and speaking to them like we are now in those particularly difficult times. And also understanding that it does bounce back. I've seen company managements succeed and fail over that period of time. And so I do think that longevity and experience in the sector, in what is a very young sector still, and that brings in a lot of very, very highly scientific people. And so the answer to the question on what's overrated, having said that science is important, sometimes I think you miss the wood for the trees when you are super, super focused on just the science. And so it kind of sits alongside the answer to the previous part. You have to be able to focus on the science and the fundamentals and how that, forms a valuation argument, alongside being able to be more able to stand back and see, where are we at cycles? When do we want to be buying this stock? Where do we want to be selling this stock? Which part of the sector do you want to be positioned in within your portfolio? So I think that, I see a lot of very, very highly experienced and highly qualified people not succeed.
It's interesting. That takes you back. I've asked this question once or twice in sort of big conferences, and certainly got a withering look from one or two fund managers when I mentioned it, but I hopefully not from you. Well, maybe I got through, but it was. So I remember going back to 2000, 2000, being very struck by fund managers who were so excited by the potential of technology, mainly around back then, that they seemed to. And that was fine at the time. But then looking back at 2001, 2002, you thought, hang on, you were so focused on all the stuff that tech could do. You didn't think of the monetary aspect, which really you should have been talking about as a fund manager. And making that link, when it sounds like you are clearly making that link, which
I think that that's absolutely important. And, you have both sides of that. You have those peaks of, arguably right at the end of COVID, when, the biotech sector had been the sector that had come forward with vaccines and and therapeutics. But equally, it's important, I think, for us who've been in the sector for a very long period of time to also point out times like we're in now, where fundamentals are not reflected in share prices, largely because of macro concerns, which I fully appreciate and fully, reflect in the way that the portfolio is constructed, but they don't reflect fundamentals. And underlying biotech is a phenomenal business model and phenomenal innovation that will continue irrespective of, what happens on a macro scale.
Great stuff. No, unconnected this because we were talking about there is clearly an extra element here in terms of the knowledge involved. What drives your approach to communicating with clients?
Yeah, I actually love that part of the job. You can probably tell, do love the sector and do love the kind of, it's such an interesting sector and it matters to people. Health matters to people, and what's happening within the sector, all the new technologies and how AI is impacting the sector. And, there's so much to talk about, and there's so many stories as well as just the actual fundamentals and investment part that I actually love that. You are right. There is an element of keeping it simple, but not over simple. But, times are good, times are bad. I mean, I love speaking to clients and I love speaking about the sector.
Well, it's happy for us. A couple more personal questions now. Try to keep this on the choice words theme and in keeping with all the previous interviews done. What was your path into investment, and in alternative university, if you hadn't taken it, what would you be doing now?
So my path was, I studied medical microbiology at Edinburgh University. I didn't really know much about financial markets at that time, but I knew that I didn't want to work in a lab particularly. I'd done quite a lot of that within my university career. And I approached Goldman Sachs for a summer internship, which I was successful in getting at my last year of university. And that's where it started. So from 22, I was working in biotech or at Goldman Sachs in London. And at that time, the biotech sector was, only a handful of companies, a handful of those large cap companies. It was just in its kind of formation. And so over the last 20 plus years that I've been involved in this sector, I've seen the growth, the expansion, ups and downs. But it was a slightly unusual path in that I'm a scientist, got into the city. Aside from that, I'm very passionate that science is a subject that has a lot of applicability. And, you have to be asking forensic questions in science. You have to try and prove your hypotheses. And actually, I do think it sits quite well with financial markets.
Fair enough. Investment mistake. It's a bit rude to ask, but what's the biggest investment mistake you're prepared to admit to? And then, what did you learn from it?
So if you think of mistakes as buying stocks that go down, there are a lot of those in biotech because, some of these companies are very kind of binary in their nature.
Which is why you have a portfolio.
Exactly, which is why you have a portfolio. But, they can move 200, 300% on the upside, 80 to 90% down. So there have been numerous occasions where that's happened in my experience. And I think that, to your point, you build a portfolio around that and you acknowledge that it's part of the job. You have to be quite disciplined on your sell process at that point and acknowledge that the thesis has changed and you sell. So I'm not sure that's a mistake. I think that goes alongside the investments part. I think, I'm very focused on doing a lot of due diligence before I buy stocks, seeing management teams numerous times doing all the work. Those cases where I've been, I've seen a management team or I've met an met a sell side who have convinced me to buy something that perhaps I've done less work than I would like, and they go wrong, I would class that as a mistake. There's been a few of those, not so many, but there's not been a big obvious disaster.
Well,
Like you're missing.
hey, good. But you mentioned narrative actually, and there are strong narratives, and I was wondering, can you get caught up in a narrative? And also, it occurs a question, or maybe a stupid question, I don't know, but are you more likely to be, our management teams in biotech more likely to try to guilt trip you to go, oh God, just give us 6 more months, and we're going to cure something?
Good question. They are definitely blue sky thinkers. I mean, you have to be, right? And they are definitely, especially when they're in early development, there is an element of this is going to be the best and this is going to cure the work. Like that, there has to be that element. That's why they start the code police.
Yeah.
You've got to believe, and that experience and that tenure that I spoke about allows me to be able to have seen a lot in my history and be able to say, okay, well, that mechanism hasn't worked for company X, Y, and Z, so why will it work for you? To ask those questions. And that's why the science is so important, because ultimately you have to be able to, hold them to account on the science side of things as well. And so that's, a fundamentally important part. Guilt tripping, less so. I really want to support companies, and, we are an allocator of capital. And I take that responsibility very seriously, and, making sure that those companies with good quality management teams, good products and unmet needs, whether they're fashionable or not, or in a hot therapeutic area or not, is really important to me. Antibiotics, for example, an area that is very, very difficult and very, very challenging from a market perspective, from an ultimate sales perspective, but so crucial to humankind going forward. Those would be areas that I would very much look at and look at supporting.
Very good. I was saying, let's move back to work. We haven't really left it. It's always all very tied up. Your personal approach and your professional approach all very tied together. But I'm going to ask, what are your best and worst case scenarios for future biotech in the UK, if you like, globally, if you like? Either way, can you get through that without mentioning the word Kennedy?
This is the core of where we are right now. The worst case scenario, I would argue, is where we stand now, or where we stood a week or two back. The FDA is so crucial to the biotech sector. I'm more positive on that now than I was maybe 3 or 4 weeks ago, actually. We've now got new people at the heads. They're saying all the right things in terms of efficiency, in terms of, using AI within the approval processes, within thinking differently about how to get drugs approved. The proof is in the pudding. Drugs, again, approved as it stands at the moment. Let's wait and see. But I'm more positive on that from where we are. But prices don't reflect that, which is interesting. And drug pricing in the US has been a challenge for a long time. And we are now, the rhetoric is out there. The headlines are out there. The executive orders out there. And so I do think that a lot of that potential risk is priced into the sector. I also think it's going to be very hard for them to implement in a way that impacts the sector that the prices suggest. And so, I do think that we are in a situation now that is possibly the worst case. And I can see an avenue to getting out. And it's no longer going to just be an overhype. We are going to come to the side, which I think is a good thing for the sector. What was the other question?
Well, we talk about upside, downside, and I just, because we did talk at a conference, WealthWise Rocket conferences, a few weeks back, and I think you were quite downbeat about it, because now essentially you've got somebody in charge of healthcare. Well, you've got a number of people in charge of healthcare who seem to neither know anything about nor care anything about the subject they're in charge of. I could be that, maybe that's a bit rude for me, but it felt like that for a while.
I think that those in charge of the FDA, which is important, are very scientifically rigorous, and that is why I'm feeling a little bit more upbeat. Where the administration sits on drug pricing, I have actually sympathy for, honestly. But how they go about, working together to do something about that, I think is going to be a big challenge. And so, yes, I mean, this is the point. Within the last 2 weeks, I have become more positive on the outlook. The administration part is very challenging, and it's not just challenging for healthcare. Honestly, it's challenging for a lot of the sectors. Where do we stand on tariffs? Where do we stand, more broadly? But there is just that unique part for healthcare, which is drug pricing in the US, and the risks that are associated with that, and the opportunities that are associated with that on a longer term basis.
Yeah, thank you. Actually, this I should say, it's very PR. I was watching. I think, oh, great, we get a fund manager on Choice. No, you can't. This was actually a public service broadcast. As we were talking, this is going way beyond portfolios. This is going to an important part in the outlook for a particular sector. So that's why we're doing this. So calm down. Then don't send me emails. Now, just finish up with a couple of the traditional endings to these videos. First of all, looking back, what advice would you have given yourself on your first day at Goldwood Type?
Work hard, be curious and ask lots of questions, and be yourself. I think there are a lot of people that are not themselves for a long time within their job, and then they, build the experience, and then they, become more of an authentic self. I would have started from that right from the start.
Oh, that's nice. Last question then. We call this choice wise. Usually it's about a bit of fund selection, fund research, but you self have to make choices professionally. These are more personal recommendations. A book, does not have to be an investment, and another one, a free choice.
A novel, which I am up to book 20 of now. So that speaks to how much I like this series of books.
Great.
So the author is L.J. Ross. She's not well known. She sets her murder mystery kind of novels in Northumberland, which is very close to where I was brought up. They're fantastic. And as I said, so I started reading book 1, I think when I just started Candrian, which was February 2024, and I'm now on book 20. So I pretty much read nothing else other than those books from an enjoyable reading perspective. And then a recommendation outside on anything else. I need to keep this quiet because I don't want to
That's the danger of this.
Exactly. A place to be, a place to visit. Iceland.
Okay.
Is fabulous. It's great for kids. It's got volcanoes, it's got hot pools, it's got ice caps, it's calm, the people are nice, it's beautiful, and it's 3 hours away.
Yeah, it's not cheap. It's got some very weird delicacies. What was it? Shark week?
Yeah, that's true. It's interesting on the price. Northern Europe is very similar. I find like Italy and the US also.
Okay, no, I mean, that's
crazy expensive.
Yes, but I had a lovely time there about 10, 15 years ago. I mean, you second mortgage when I came back. But I think things are a bit better.
Well, just on a relative basis, it doesn't stand out as much as I think it used to.
Well, those are fantastic choices, Peter. Thank you for talking to us today. And thank you so much. Please do look out for further Choice Words videos as they come up.